Hi everybody, my name is Dr. Courtney Conley and I am one of the founding members, if you will, of the Healthy Feet Alliance. We are going to be shooting a bunch of videos for you guys on foot education and basically how to improve your foot health. And today what I wanted to talk to you guys about were the parts of a shoe because it's very important what you're putting on your feet. That is definitely one of our goals at the Alliance, is to educate on what is out there. So what we wanted to talk about, and I'm going to demo on Splay Athletics. So we are going to talk about the different parts of the shoe, and specifically what I wanted to talk about was something called a heel to toe drop. When we talk about functional footwear, there's a couple characteristics that you want to look for. We always talk about having a wide toe box, okay, so that the toes and more importantly the forefoot can splay. So there's a reason we need that splay when we're walking, because when we have that forefoot splay, it triggers a cascade of stimulation of receptors in the foot that basically allow that foot to become stronger to propel forward. So in shoes that basically suffocate or don't allow the forefoot to splay, we don't take advantage of one of the, what I like to call the free mechanisms of the foot that allows it to get us to move more efficiently. So that's where that toe box is very, very important. Something I also want to talk about is there's a difference between a wide shoe and a wide toe box. Okay. Unfortunately, a lot of shoe companies out there, this is the last of the shoe or the bottom of the shoe. This is expensive to alter. So unfortunately, some of the shoe companies out there will, instead of changing the width, they change the depth of the shoe. So when the patient puts their foot in the shoe, they feel, oh, I have all this room in there. Well, not necessarily in this direction, maybe in this direction. So you really need to, that's what we want to do here, is educate you guys on what is out there. If you are in question of if your shoe does have a wide toe box, simply take out the factory insert, okay, and put your foot on it. If your toes are expanding over the factory insert, then you can probably be pretty certain when you shove your foot into the shoe that it's going to be getting squeezed right at that most important part of the splay, which is at that forefoot. So that's an important piece of the footwear. Okay. The next thing we like to talk about is something called the stack height, and that's basically from the bottom of the shoe to the ground. Okay. We want to have a thin sole or a stack height that's minimal. Okay. This is a splay shoe, and this is the Ultra. Okay. Both of these, and I'll get to this in a second, are zero drop shoes, but you can see the difference in the stack height. This has more cushion on it, okay? If there's more stuff between the sole of your foot and the ground, then you're not gonna be able to, again, take advantage of all the 200,000 sensory receptors on the bottoms of those feet that allow us to become efficient movers. Okay, so with footwear, we wanna have a thin, flexible sole and a wide toe box. Okay, the next part of the shoe I wanted to talk about was the heel counter. Okay, the heel counter again should be flexible. Okay, in patients that have Achilles tendonitis, for example, insertional Achilles tendonitis, you have heel counters, and some of the footwear now is actually pushing into the heel counter. That's going to irritate the Achilles tendon. Okay, so that's something that we want to be aware of in the shoe. The next part of the shoe is something called the upper. And the upper is basically the material that's on the top of the shoe. The vamp is the material that's on basically the forefoot of the shoe. A lot of companies now are kind of catching on board, and they're putting the vamp or the material across the toes, kind of like in this mesh material. Why? So that we can have that forefoot or that toe splay. The material is more giving. For those of you out there that have bunions, hallux valgus, Taylor's bunions, okay, pay attention to what the shoe is doing. If there are seams along the sides of the shoe, they're going to be uncomfortable for you, okay? And the last thing I wanted to talk about was the heel to toe drop. okay? Because we get this question a lot, and we get people that want to transition into what is called a zero, okay, drop shoe, which is when the heel and the toe sit on the same plane. So it's a zero drop from the heel to the toe. Believe it or not, most of the athletic shoes that you see out there are not zero drop, okay? They can have anywhere from a 2 millimeter drop up into a 10 millimeter drop, and this would be a 10 millimeter drop, a little exaggerated, okay? But you know, it's all the same. Once you get above zero, it's all the same, okay? Here's 10 millimeter drop, okay? What if I have a patient that has Morton's neuroma or pain in the front of the forefoot? Does this look like fun to them, okay? No, because it's not. So if I can put the foot on a plane that's in a zero drop plane, my foot's going to function more functionally, okay? You like that? All right. Now, you're running around in a 10 millimeter drop, okay? And you say, oh, I really like this video. I'm gonna go buy a zero drop shoe. Hold your horses for a second, okay? Because depending upon how long you've been walking around in this shoe, if I drop this down to a zero drop too quickly, the two structures that take a beating with that are the Achilles tendon and the plantar fascia, for example. Because I drop the heel down, I put tension along the posterior compartment, and you start to get a tugging on these tissues, if you will. So there is a transition between going from a higher heel to toe drop shoe to a flat or a zero heel to toe drop shoe. So for those of you who have questions about this, the transition, especially for my runners, is very, very slow. I'll take them into a transition shoe. If they were in a 10, I might drop them down into a 4 or 5. They're gonna run for a couple minutes, put their old shoe back on. Did you hear what I said there? Couple minutes, okay? Put their old shoe back on, and then slowly transition so that we're taking the tissue with graded exposure to improve tissue tolerance, okay? So that's gonna be an important factor when getting into a zero drop shoe. So that is the information that I have for you guys. Oh, one more thing, okay? I can't believe I forgot about this, okay? These are correct toes, okay? One of the other founding members of the HFA is Ray McClanahan, who designed these, okay? Guess where these fit nice into, okay? Into shoes that have a wide toe box. Okay, so, you know, all of these things are geared towards improving your foot health, and that is our goal at the HFA. So, thank you for hanging out. If you want to join the community, the Facebook community, it's the Healthy Feet community. And we're going to be posting this video. If you have any questions, just comment below, and we will all certainly get to those. Thanks so much.